Good afternoon, Gonawage. It's December 17th, Friday actually. We were hoping that we wouldn't have to see you until after the holidays, but some changes to our current status regarding COVID-19 is bringing us to having to speak with you today to give you some new information about COVID-19, the Omicron virus, the Omicron variant, and some changes that we will be putting in place here in Gonawage. So first off, I'd like to just give a little bit of an overview of predictions of what we're expecting in the coming weeks. So as you have probably heard much of in the media, Omicron is a new variant of COVID-19, which is present here in Quebec as well. We have not seen any Omicron variants here in Gonawage yet of those cases that have been sequenced by the labs. However, what we have seen as of 2 days ago, there were 38 cases in the Montérégie area, 95 cases in Montreal. And what we're expecting, because of the rapid increase in transmission of this variant, is that cases will double every 2 to 4 days. And predictions at this point are showing an expectation of approximately 10,000 new cases per day come January 1st. What we also see with Omicron is an infection rate, so a transmission rate 6 times higher than that of Delta. And what we know up till now is actually what we have as information right now is preliminary data that comes from other countries. So I mentioned this a couple of days ago. And so we have to make decisions based on incomplete information. And the reason for this is because of that rapid transmission rate that I spoke to you about. By the time we have accurate information that allows us to make decisions that are specific to this variant, it will be too late because cases will have jumped quite significantly. So this infection rate is quite high. What we're hearing about severity is still very unclear and differs depending on the evidence that you're looking at from which country. So I'll give you the information that we have from South Africa. Originally, Quebec was really looking towards South Africa, where the Omicron variant was transmitting very quickly. So what they're seeing out of South Africa is that although the variant is very transmissible, it is less severe. So they're seeing that the variant is causing symptoms that are more flu-like, so again, less severe, less hospitalizations, and less death. However, if we look at evidence from Denmark, what we're seeing is that although it is slightly less severe, meaning there is less death from the Omicron variant, they are seeing similar rates of hospitalization as the strains of COVID-19 before Omicron. So again, this data is differing. What they think could contribute to the difference is that in South Africa, many of the Omicron cases are reinfections. So people are getting Omicron virus after already having had COVID a first time, and perhaps this is leading to a decrease in severity. So again, this is still unknown, but what we do know is that with a significant increase of cases all at one particular time, this inevitably will lead to an increase in hospitalizations and a potential overwhelming of the hospital system. So that's one reason why this is being looked at as needing quick action in order to protect the hospital system. And of course, protect all of us who require using that hospital system for many different things other than COVID-19. What we also know up till now, and again, this is preliminary evidence, but we do know that vaccines are still effective against Omicron. However, efficacy is significantly lowered. So if you only have 2 doses of a vaccine, your protection or the efficacy rate against the Omicron variant is approximately at 34%. Once you get a booster, then the efficacy rate rises to approximately 75%. that we're seeing this in preliminary data. So vaccination still is very, very important in the fight against this virus. What we're also seeing is that because of this sharp increase in cases, we're predicting that contact tracing and therefore isolation within an appropriate time frame. So we had always said 24 to 48 hours is required. We're predicting that that will be impossible. So there are just not enough resources to be able to contact trace effectively and therefore isolate those who have COVID-19. And again, so that will lead to further significant increases in cases. So what does all of this mean? What are the impacts? What does that mean for us here in Gonawage? So again, as I mentioned, if there is a sharp increase of cases, inevitably there is a percentage of those cases that will be hospitalized. It may not be a lot. Many of us might say, well, what does that mean for me? I'm young, I'm healthy. If I get the Omicron variant, from what I'm hearing so far, it'll be like a flu. I don't have to worry. But what we do have to worry about is who we transmit to, our most vulnerable population, children, very young children. We have had hospitalizations over the last wave. In fact, we have a child who's hospitalized at the present moment. This is not about fear, it's about having the knowledge so that we can make decisions to protect ourselves. It's really important. And when you increase cases, you inevitably have a percentage of those cases that will require hospitalization. And of course, just one hospitalization or death is too much for our community. So secondly, what does that mean for us is that there is an impact to the most vulnerable who, even though many are vaccinated, have a decreased effectiveness in the face of this new variant. We also know that with this increase in cases, with the transmission that happens so quickly within one particular area, we could have a huge impact to our essential services, meaning that if all of the nurses within one particular area, for example, get the Omicron variant at the same time, that will impact our ability to be able to offer services. Same for, I use the example of the hospital, but it could be at Dewa, or it could be at MCK or at KSCS. In any particular area with this transmission that happens so quickly, it could actually impair our ability to offer service. Not only that, but the other impact of this sharp increase in cases all at once could have a drastic impact to our businesses and our businesses' ability to remain open. And of course, as we want to protect everybody, businesses or the economy is part of that protection because it is part of all of the determinants of health. All the things that make us healthy is our mental health, our spiritual health, our physical health, and also our ability to provide for our families. So we want to protect our private businesses. Again, if all of the workers within one factory, for example, become sick at the same time, it impacts the factory's ability to continue. Another impact is to our ability to educate our children. Again, one of the determinants of health. We need to be able to educate kids. Kids want to be active, be in school, so we need to protect our schools and we want to be able to keep them open. And so a huge increase in cases, all of the teachers impacted at once or many different classrooms could impact our ability to keep our schools open. So we're looking at all of these potential impacts, and even though we don't have all of the information, we know that we have to make decisions immediately in order to protect those main areas that we spoke about. And again, that brings us back to some of our priorities and our guiding principles that we've discussed at several times here about what's important for the community and what are the principles that we use to guide our decisions, and they all focus on these areas. So we want to protect the community in several ways by the measures that we're going to speak to you about today. We're going to talk about changes to public health measures. We're going to talk about testing measures. We're going to talk about vaccinations. We're going to talk about, Robin's here to talk about school measures, and Lloyd will then talk about health directives. So let's talk about public health measures as a start. So this document is a document that we post on Gonawage 911 on the KMHC website, and basically what you see in yellow are the changes as we go. So this is a December 17th document. It's published today, and what's highlighted in yellow are the changes that will be effective immediately. And so I'm going to go through just the parts that are highlighted, because those are the important changes as of today. The other information is still in effect. So what I wanted to mention about so this document, first of all, is separated by public health measures, and I haven't gone through it in a while. So it's organized by symptomatic individuals, so testing. It's organized by then contact tracing. The next section is about masking, distancing, vaccination measures, and ventilation. So we usually provide updated information as we go regarding these measures, depending on the level of risk that we see in the community at any given time. So for symptomatic individuals, we are still highly recommending that you get tested if you have symptoms. What we're seeing right now is that generally only 40% of individuals with COVID-related symptoms are getting tested. Remember, the more tests that we do when we have symptoms, the easier it is for us to prevent transmission. And again, we want to avoid all of the risks that I spoke about just a few minutes before. So testing is very important. Now, I say that, and in the same breath, I'm going to say, if you don't need to be tested, it's important that you don't take up the resources of the testing centers. Meaning, if you're vaccinated and you're a contact of a positive case, you should not be tested unless you develop symptoms. And when you develop symptoms, if you do, then you would get tested. The reason why I say this is because many of the testing sites currently are overloaded throughout Quebec. And not only are the testing sites overloaded, so we know that Chateauguay, for example, it was impossible to get an appointment in the last few days. KMHC site is often full. Not only are the sites full, but the labs are also full. And currently, we are not getting results anymore in that 24-hour period that we really need in order to be able to control the transmission of the virus. Results are coming in now at 48 to 72 hours. This is too long. And so we have to make sure that we're using the resources in the best possible way. And that means that if we're a contact of a positive case with no symptoms, we should wait before we get tested. Another change is regarding contact tracing. So contact tracing is becoming increasingly difficult. I alluded to this a little bit a couple of days ago, but I want to talk more specifically about it. Regionally, if you get tested, if anywhere around Gonawage, it's been quite a while since they've been overloaded in their testing in their results area. So no, they are no longer contact tracing outside of Gonawage. We have still maintained contact tracing up until now. However, we predict that over the holidays, so in the coming days, that we are no longer going to be able to contact trace. So what will happen is that if you receive a positive result, you will get a call from public health. We will speak to you, we'll help you identify your contacts, but then we will request that you, as the positive person, that you advise your contacts that you are positive. And those people who, contacts who are vaccinated, will have to self-monitor for symptoms, as we've been doing up till now. And those people who are not vaccinated will isolate for 10 days. And so we'll guide you through that when we speak with you, but it's important that the community be aware that we will no longer be contact tracing unless we can. So if the numbers allow us to be able to do so, then we will continue to do so. But we do expect that we will no longer be able to contact trace within a matter of a week or so. I'm going to talk a little bit about rapid tests in a little bit, but what I do want to say to start off about rapid test is a little bit of a precaution. So as we've mentioned, we will be providing rapid tests to every community member, a box of 5, and a communique went out or is going out today, so you will have information about how you can have access to those tests. They will be distributed. They will be distributed over a span of 4 days, starting on Monday the 20th until Thursday the 23rd, from 8 till 4 at the sports complex in the parking lot. And it's basically a drive-through. You drive through and you'll be handed your boxes while you're sitting in your car. And again, it's 1 kit per household member, and each kit has 5 tests. So important about that is there are instruction videos that that Juanita and Dawn prepared, and there's also a document that has written instructions both in the box and a link on our Gonawage 911 page, so you have all of the information you need to be able to do those rapid tests at home. Rapid tests are an extra tool. So remember, we have many tools to protect ourselves: distancing, masking, hygiene, ventilation, and now we have vaccination, and we also have rapid tests. These rapid tests allow you to have some information to be able to protect yourselves and make appropriate decisions. But there are some things that are important for me to mention. Rapid tests are not as accurate as a laboratory test, so a PCR test that's done at a testing site and then in a lab. And we have to keep that in mind because we are seeing false negatives and false positives from those rapid tests. So if you get a negative result, it's really important that you keep in mind that all of the other measures that you know of, masking, distancing, all those other measures, that you maintain them. A negative result is an extra safety measure, but it's not necessarily fully reliable. If you get a positive result, same thing. It could be a false positive, and we are seeing sometimes false positives, and that's why we ask that those positive results be validated by a PCR test. We're giving a lot of information today. Much of this is going to be coming out also in different communiques, so you'll have access to it later. But there are several reasons why we need a PCR test. We've spoken to people and they say, well, that's ridiculous. Why do I have to drive and go to a testing site, get myself tested? Here are the reasons why. Number one, you want to validate that your result really is positive, because isolating yourself, your whole family, could have serious consequences on well-being as well. So we try to isolate people the least amount as possible. So you want to validate that you really are positive. Also, when you receive a positive result from a rapid test, whether it be from the box that we give you or from a private clinic, public health is not aware, and therefore you don't have the assistance of public health to, first of all, provide you assistance if you're sick, and we do oftentimes have to speak with community members on a daily basis to provide us medical assistance. But you also don't get the fact that you're COVID positive identified in the database. Why is it important that this be identified? If you travel and you don't have, somebody I know recently who had COVID-19, the fact that they were infected with COVID-19 and it was recognized in the database by public health, it showed up in their proof of vaccination measures, so their vaccine passport. Why is this important if they are to travel? You want it identified that you were positive before you left the country. Otherwise, when you get tested to come back into the country, if you have a positive result, they will not let you in. However, if they know that your infection was within the last 3 months and was prior to your travel, then this will not be an issue and you won't be expected to be tested before coming home. So this is an important reason why it's important, why you have to have your infection documented with public health. Also, it's really important that public health assists you with contact tracing because, again, we want to try to limit the spread as much as possible. It is not shameful to have COVID-19. It is going to be widespread. There are many people who are going to have COVID-19. We want to protect the most vulnerable and we want to limit the spread as much as possible so that we protect ourselves and the hospital system around us. So that's for the rapid test. I wanted to talk a little bit about masking measures because this is a change as well that we're making. We're again highly recommending that masks be worn at all times between households, especially if you don't have your booster shot yet. It's definitely required now in all community organizations when in common spaces or in shared offices. And again, we recommend that masks be worn at all times. Vaccination measures. We still are seeing huge positive impacts of vaccinations. Lloyd mentioned them a couple of days ago. We're still seeing that with the Omicron virus, especially with the boosters. It's making a huge difference. So again, what I want to mention about that is that we know that there is difficulty accessing boosters. You all want your boosters, and many people are showing up either through walk-ins or even by appointments to the Knights of Columbus. But I need to mention that our resources are really tight, and we're asking for the community to be understanding about this and to treat our employees and all the employees with respect. Please take into consideration the fact that people who are working at the vaccination sites are the same people who work at the testing sites, are the same people who work in contact tracing, in public health. Basically, we move our staff around depending on the need at the current moment. We only have so many resources, and therefore, right now, those resources are needed in all those areas, and we can't keep up with all those areas. What you're seeing here in Gonawage is happening all throughout Quebec right now. Everybody is unable to keep up with the demand because there just are not enough resources to go around. So yes, you might have to wait a half an hour in line even if you have an appointment, and we're sorry about that, but we can't do anything about it. We also have a smaller area, so we can't have as many people in the space as we had at the bingo hall, for example. So we're at a limited capacity in that sense as well. So again, what we're asking is that you do get your booster, and we are being aggressive about it as much as possible, trying to get as many people in as possible. We have help from the feds. We have some nurses in from the federal government has loaned to us. We're doing everything in our power to meet the demand right now of the community and increase protection over the holidays. But we really are doing our best. I think that's it for the public health measures. I talked about testing. I talked about vaccinations. I'm going to ask Robin now to come and speak about school measures that will be implemented, and then afterwards Lloyd will speak about the public health directives. Thank you.
Good afternoon, everyone. So thank you, Lisa, for the update and providing some really clear information to community about what is currently transpiring around us. So for those of you who may not be aware, I am Robin Delaronde, and I'm the Director of Education for the Gonawage Education Center. And today I would like to give you information about some of the plans that we have decided to implement as of today. So this morning, I met with local public health and other KEC reps to discuss the situation and how this would impact and may impact the opening of our schools after the holidays. After receiving the information and looking at what could potentially happen, we made the decision that we were going to implement what we called a prevention plan, basically. What this means is that the KEC will be extending our winter break to January 7th. So I want to give people more details about what this prevention plan entails and the particulars around the dates and what was originally there in the calendar and how this will impact parents. So during this break time that we're extending it from the 7th, so basically what we're doing is we are asking and requiring all students and our staff to remain home. Our staff, like many other people, but I'd have to say more so our teaching staff and individuals at our schools, have really been going through challenging times with, yes, absences, teaching the children. There's been other issues that have been coming into the doors of the schools that really have had a lot of impact on wellness. So for our staff, this is quite helpful and I'm sure appreciated from them as well. So what is occurring is that in terms of the regular calendar, what we had put out there originally is that Monday and Tuesday of once we return from the holidays were of course part of our Christmas break. But what was then going to occur is that originally we had Wednesday January 5th and Thursday January 6th were going to be 2 days that the students would actually be on site and return to school. There were the 2 floating PED days that we had placed for midwinter. Now, one of those PED days was the 7th, Friday, January 7th, and we placed the other PED day on Monday, January 10th. So technically, students were coming back into the schools for 2 days. Keeping that in mind, we really felt that closing our schools during these 2 days and closing it to the students and the staff was critical, and I'll explain why. During this period, what we identified is that, prior to, I should say, is that we are all well aware that it is a Christmas break. We acknowledge and appreciate that families will be gathering. Families have probably made some plans for vacation. And there's a abundance of things that we have all planned for our holidays. We know that, and what we're concerned with is that upon the return after the Christmas holidays and the New Year's, there is obviously that period of time where we will more than likely see some cases rise. And during this period that I identified by extending it to the 7th, what this does is it gives us that opportunity to, and allows us to really get a clearer picture about the impacts of the holiday season. It allows us to be able to see, for example, are there any cases, are people ill, and so forth. With that, what we're asking parents and we're asking our staff during this period of time to do is to take that period, monitor for any COVID-19 symptoms. And of course get tested immediately. We are, as much as possible, encouraging families and our staff as well to remain within their bubbles, family bubbles, and practice the preventative measures that are recommended here. We are asking and really asking that because of this extended period, this extended week, we are really asking that parents do not then say, okay, it's an additional week. Let me make an additional vacation arrangements and travel internationally or so forth. Basically, this is a period, a week, where we're hoping that families, staff will take that time to rest, relax, monitor their health, and be able to respond to it, so that when we do open our doors for students, which is going to be on Tuesday, January 11th, we will have a clearer picture. We will open our doors and resume our classes without interruptions, without teachers being coming in and being sick, or students. And then, as Lisa had explained, that it's quite possible that we're going to see higher transmission, and then we would see probably more closures. So this period of time really allows us to really take stock of what's happening in our schools, get our staff, our students and families prepared, so that we can open the doors with better transition. Basically, that's the information that I wanted to share today. I also did meet with this morning with other education organizations and relayed this information. And what will be happening is that if you are a parent who has a student who attends Indian Way, Gariwa Noru, Radiwana Nirats, and so forth, they have been advised, and they will be releasing their information and plans as well shortly. I do, and we do anticipate and understand that these days obviously could impact parents who are essential service employees and who do need services during this time. More information is going to be coming forward on Monday regarding essential services and daycare during this period. So please stay tuned and open for that information. So with that being said, I really do want to encourage everyone to have happy holidays, enjoy your family, take care of your wellness during this time, and overall, enjoy your family and the break that we're all having. And I wish everyone all the best. So, Yamagoa.
Thank you very much, Robin, Lisa, for the information. I know there's a lot of information here on the show today, but I think it's very important that the community is up to date as much as possible on what's going on and what's happening immediately and also in the next little while within our community. And a lot of this information, as mentioned, will be posted on various websites and also on links with Facebook. So really what is happening and with this new variant, as we're seeing, is there is definitely a storm brewing. All the data and all the projections, across the world, for that matter, North America and Quebec, is that we see a dramatic increase in positive cases over the next few weeks. So, we see a storm coming. So we have to prepare ourselves in the best possible way to weather that storm and protect our community as best as we possibly can. We've been through 4 waves of this pandemic, and now with the dramatic increases we're seeing and going to be seeing, we certainly could call this the 5th wave of the pandemic. And the way and the transmission of the new variant and the very high transmissibility of it, it could hit very hard and could hit very fast. So now is the time for us to take action, and we need to be proactive as we can, utilizing all the tools in our toolbox to keep our community safe, but also taking additional health directives to ensure that our community, again, is safe as we possibly can. Actually, there was work started on Wednesday and again Thursday with the public health team to assess the new data and new information, coming out, and preparing recommendations for consideration from to mitigate and be proactive within our community. This work actually started prior to Quebec's announcements, and a lot of the information and recommendations that they came up with are very similar to what Quebec has already announced. So we did have discussions We met again this morning to go over it. I also had a discussion with the elected representatives and the port chiefs for the health and safety, and as well as the Grand Chief and Assistant Grand Chief, to ensure that everybody's aware and on the same page. So moving forward, we are going to be implementing some health directives effective on Monday, the 20th, and I'll run through those very quickly. But also our local inspectors are going to be visiting each business that's impacted directly to explain the latest measures. The biggest area that was identified was number of contacts. But that basically means the number of people who you associate with or have contact with, throughout the day should be decreased as much as possible by 50%. This was a recommendation that came out, and so effective on the 20th, we're looking at restaurants, bars, social clubs, and gaming facilities to reduce their capacity to 50%. That masks for all employees will remain a requirement. For the gaming establishments, the masks will be mandatory at all time, even when sitting. Cigar lounges as well, they are going to have to reduce their capacity to 50%. Obviously the customer registry and the proof of vaccination is still going to be a requirement, as well as proof of vaccinations, even if there's going to be a hall rental as well. For retail and shopping, there is no per se restriction on capacity, but we do want to reinstitute the 2 meter distancing, which may lead to a decrease in capacity, but we want to reinstitute and talk about that, making sure people are reminded that the 2 meter distancing should be respected. Manufacturing and construction, masks should be worn at all times when indoors, and masks should be required when you are outdoors if you're in close contact with other individuals outside your household. Churches, funeral and ceremonial gatherings, again, that's also reduced capacity to 50%, and masks are required. Indoor private gatherings, we had it at 12, it remains at 12, but masks, again, are highly recommended between different households. And as mentioned, especially if you have not yet had a booster shot, as well as limiting your contacts if you have indoor gatherings. And so you don't have an indoor gathering or say an office party or such where you have multiple gatherings or multiple small parties you may go to. Maybe I know some are already taking place and took place and are planning for this weekend, but you minimize that as much as possible. Maybe pick and choose a little bit which parties you want to attend to and which gatherings you want to go to. Again, to minimize contacts, minimize the spread of the virus. Organizations are also having their masks mandate reintroduced, and they are going to have a return to remote work for non-essential workers. Sports, all tournaments are canceled, as well as the sports complex capacity will be reduced to 50%. Again, hall rental is still permitted, but again, we have to make sure that the 2 meter distancing rule applies. Public transportation, masks have always been a part of it, and they will remain. But now with some events in the community, as of the 20th, like live music, karaoke, and that type of activity is no longer going to be permitted. It's an area in which we start, these documents are also going to be made public in a very short period of time. But it's an area that we felt is required to mitigate and minimize the impact of the Omicron variant that we don't see yet in our community, but it will definitely be something that we are anticipating to be seeing and seeing quickly in the coming weeks. So again, it's a matter of being proactive, addressing the risk in a measured response, And those people were looking at what measures may be coming up, and we feel at this point in time, these measures will, in conjunction with your personal responsibility, with the rapid testing, with the delay in school openings, well, we're hoping this will be enough to be able to have a situation where it is manageable in our community, and we protect our community as much as we possibly can. Because there is, like I said, the possibility of this fifth wave with the transmissibility of the variant. We could see a tidal wave, and that's what we want to avoid as much as we possibly can. Protect our frontline workers, protect our infrastructure, protect our communities, and making sure essential services in our community is still able to be maintained. So it's a situation that we didn't want to be in. As I spoke on Facebook Live on Tuesday, I said restrictions weren't something that was out of the question, and it really, to be blunt, it really does suck that we are in this situation now. But again, we need to stay vigilant, stick together as a community, and really push through this. These measures will be in place for a minimum of 30 days. We will be doing our ongoing assessment after the holidays, and we will see if at that point things could revert back to the way they were previously, or if we have to make any additional modifications. And as things progress over the next few weeks, we also will have to assess current measures and again, health and safety, and following the science, as we've been saying since the beginning of the pandemic, is going to be our priority. So with that, this information will also be put out publicly, and please take care, everybody, and talk to you soon. Gonawage.